Over 200 people with various forms of defects have benefited from free plastic surgery by a visiting team of doctors at the Bolgatanga Regional Hospital in the Upper East region. A plastic surgeon, Dr. Michael Kwame Obeng, who led the exercise, said most of the people are unable to afford the cost of plastic surgery, even though their conditions are critical.
The Bolgatanga Regional Hospital, also known as the Upper East Regional Hospital, is a major referral center and the first port of call for all health-related emergencies. Yet, there is not even a single specialist doctor to handle cases esoteric to their reading. In all, the doctor-patient ratio is woefully disproportionate to the disadvantage of the patient. The figures are not too good. For instance, doctors present at the Bolga facility are not up to 1/3 of the numbers required. It is against this backdrop that the Deputy Director, Diaspora Affairs at the Office of the Presidency, Nadia Adongo Musa, in conjunction with health authorities, brought 5 specialist doctors and nurses to the Bolgatanga Regional Hospital. The medical team spent time to correct deformities. Previously, all such cases were sent to the southern part of the country for treatment, and huge sums of money were spent on patients. Dr. Kwame Obeng, who is the leader of the doctors, called for drastic reforms to be made to Ghana's healthcare system to prevent needless deaths. He is of the view that access to healthcare in this present age should no longer be difficult for Ghanaians because of the strides made in development. Again, he urged that people be made to care more about preventive health methods and lifestyles. It was heartwarming to hear the doctor point at reduction in deaths caused by infectious and communicable diseases, ironically, the most pervasive in the advanced world.
I've always had to believe that a healthy nation is a wealthy nation. We live in a society where nobody cares, I don't know much about Bolgatanga, but in 2011 I went to Tamale. And I was shocked that they had a stadium. They have a stadium, but they did not have a mammography machine. The mammography machine is what, $15,000? Okay, they can put up a stadium, but they don't have a mammography machine. That's backwards. You can't explain this to foreigners. You can't explain this to people that. What are our priorities? We should wake up, we should get smarter. They're much smarter than this.
Madame Faustina, whose 12-year-old boy had his deformed ears corrected, shared her joy with GBC 24.
Initially, we even thought maybe they would take something small, so we went for loan, but when we came...
The Deputy Director, Diaspora Affairs, at the Office of the President, Nadia Adongo Musa, expressed her satisfaction about the ongoing exercise.
Looking at how things are going, we are on course, and again, I'd like to thank you. The amazing doctors and volunteers that have come all the way from US and Germany, our own local doctors that have also come to help, and also the help of the nurses and doctors from the Bolga Regional Hospital. I'd like to thank everyone for making this day happen.
As at the time of filing this report, other patients were streaming in to obtain health care from the visiting medical team. Most of the cases reported to the facility include congenital abnormalities such as cleft lips and palates, post-burns complications, trauma burns, and overly enlarged stomach and breast.